Our treatment schedule is similar to things like physical therapy and chiropractic and other manual modalities. We do like you to come in twice a week at first, and then we quickly try to wean you down to once a week. And then depending on what your individual goals are and what condition you've come with, um, we might go ahead and discontinue care. We might put you on a maintenance plan. It really depends. And to give you some examples of those, if somebody comes in with, say, arthritis, chronic low back pain, they've had surgery, arthritis has settled into the joints now from the surgery, and they're on pain pills. We see a lot of that, and we work to try to decrease the dosage of pain medication that people are taking. But unfortunately, we're never going to be able to get rid of that arthritis. I can't go in there and undo the effects that the arthritis has had on the body. What I can do is decrease how much you notice those effects. So somebody like that is probably going to need maintenance therapy. We'll get them to a place where they're comfortable. If they came in with, say, an 8 out of 10 on a daily basis, I will always ask, will you be happy at a 4 out of 10? Do you want a 2 out of 10? Will you be happy at a 6 out of 10? Sometimes people, they just want to feel a little bit better. And all of that goes into determining your treatment plan. So if your goal is to get to, hey, I'd be happy with a 3 out of 10 on a daily basis as my pain because I know this arthritis isn't going anywhere, then we kind of we'll treat you weekly until we get to that 3 of 10. It might be 4 weeks. It might be 10 weeks. Everybody responds a little bit differently. And we try to be very upfront with people about that here. We are not a practice where we're just going to tell you to keep coming forever. Let's see what happens. If you're not noticing and I'm not noticing very specific results that are getting us towards where you want to be, then we're going to reevaluate the treatment plan, refer out, put our heads together and see what else we can do to hopefully get you moving in that direction. But most likely that person is going to need to come back maybe monthly, maybe every 2 months. And the way that we determine that, I always tell people, is spread it out and see how you do. You did okay with 2 weeks? Awesome. Let's go for a month. You come back in a month, you still doing okay? Perfect. Let's go for 2 months. And we do it like that. And eventually we're going to hit a point with something like arthritis. We almost always hit a point, we hit a wall where, hey, I can't go 4 months without treatment. I noticed my pain went back up to a 4 out of 10. Okay. All right. Well, let's go back to 3 months, and maybe 3 months is your number. And after a couple more treatments, let's try again. And then you have other people who come in just for stress, who they don't need really frequent treatment. They just come in when they're having stress, if something's going on in their life. Or somebody who, I see a lot of golfers who I only see when it starts getting nice out and they want to start getting on the course. They have chronic golfer's elbow maybe, and I can treat them once a month throughout the golf season. They feel no pain. They can golf great. I don't see them again until the weather is good again. So the treatment frequency and how many treatments you're going to need is really dependent on what your goals are. And so we have to have a really honest conversation about that in the beginning so that we can both be on the same page.